I labeled my talk Navigating Alternative Payment Models While Preserving Quality and Value, because many of us are asking if it is possible to preserve quality and value in our healthcare system, especially when the number of alternative payment models seems as varied as the number of stars in the sky. Before we dive into how this navigation is possible, let's first define quality and value. Quality is defined as a degree of excellence, yet there is an inherent understanding that quality must also be consistent to truly reach that standard. Value is defined as worth, or a fair return for something exchanged. In our current model, we also see a shift in payment from models from volume-based payments based on a fixed rate of pay that increases with the volume of patients, seen towards a value-based system that is a scaled payment model based on reaching defined parameters of quality and value metrics that are set by the payer. As the value of care increases, the level of pay to the provider increases. Some of these models include a certain level of risk, meaning the provider may accept a higher amount of payment if they are willing to concede that they must repay the payer if they do not reach those value or quality metrics. With this backdrop in mind, you may be wondering why a physician would focus on quality and value. I began my journey in healthcare as a family medicine physician, treating patients from all stages of life, pediatrics to geriatrics, from house calls to the hospital. Over the course of my career, helping patients overcome and manage illness, manage their health, regain function, and take control of their lives has been very fulfilling. The challenge was navigating payment for the quality of services I was providing. I realized that in order to improve the healthcare system, my role in healthcare needed to expand. To help patients, payers, and providers, I needed to do more than serve one patient at a time. I had to engage in population health to educate and understand populations and utilization management to ensure our fixed and finite resources were used appropriately to be available to everyone. By doing this, I could impact our healthcare culture for the benefit of many patients. This career expansion has been girded by certain principles. As a physician, I took an oath to do no harm to patients. But in terms of global healthcare, not doing harm should be the minimum expected standard, not define the pinnacle of success. It is imperative for me to work for a company that aligns with my Hippocratic oath. In addition, I wanted to work in a culture that helped people thrive and not simply survive. Happily, I can say that during my tenure as an executive physician, supporting population health and utilization management, I've had the privilege of working on behalf of hospitals, hospital systems, and healthcare companies, and all of them have been focused on doing what is right for the patient. So let's turn to the topic at hand. How do we navigate towards quality and value in our current healthcare system, regardless of payment model? Healthcare providers, payers can utilize a robust clinical model as their North Star to guide them to the safe shores of quality and value. My current company, naviHealth, has a patient-centered philosophy and is focused on senior care and care transitions. naviHealth has managed patients in multiple payment models, including Medicare Advantage plans, bundled payment care initiative programs, comprehensive joint replacement, direct contracting entities, and affordable care organizations, while still driving consistent quality results regardless of the payment model. We do this by applying the same clinical model across all payers. So from my perspective as a physician, the patient's payment model never enters into my utilization management decision-making process. As a clinician, I appreciate this patient-driven care model, which ultimately brings both quality and value. Well, how does our clinical model do this? From our experience, 3 critical elements are necessary for a successful clinical model: technology, talent, and relationships. Why build on these 3 elements? A model that only utilizes regulatory criteria is like rowing a rowboat with only one oar. There's a lot of movement, lots of water splashing, there's no progress, and sometimes you go in circles. Similarly, a clinical model that only focuses on criteria, for example, will transition patients from one location to the next, but with no goal or direction, it's impossible to reach quality and value. Let's talk about these elements in more detail. First, technology. We use predictive technology to guide our application of a CMS regulatory criteria. This ensures we are consistently recommending the right patient to the right care for the right length of time and the right intensity of services. This technology is not simply employed at the beginning of the patient's rehabilitation journey, but is updated at regular intervals with clinical information in real time to ensure the patient is on track to reach their goals. This pairing of technology with the clinical documentation provided by the rehabilitation facility supports a consistent, patient-centered, evidence-based, clinically guided approach that supports value-driven care. The second pillar of our clinical model is talent. While our technology is robust, it is only useful when paired with the experienced clinicians who shepherd our patients through their rehabilitation journey. We employ the talent of over 100 physicians and hundreds of licensed clinicians, including registered nurses and degreed occupational, physical, and speech therapists who engage their clinical acumen and experience to support our clinical model. Patients are paired with a clinical care coordinator personally and/or virtually upon entry into a facility, so they are never alone during their journey. Finally, the third pillar is relationships. We have found that a high level of engagement, education, and communication with the patient, health plan, and the providers is crucial to success. In a phrase, relationships are everything. By developing strong relationships with the patient and the facility, we can anticipate changes and address barriers to discharge. These relationships are not only vital at the patient care level, they are also necessary at the partnership level with the health plan. We leverage our relationships to foster communication between the provider and payer to show where we are aligned, help reach shared strategic initiatives, and determine how we best serve our patients and positively impact healthcare. Positive, proactive relationships built on the assumption of positive intent by all parties leads to not only successful collaboration, but also improved patient and provider experiences. For patients going to post-acute nursing or rehabilitation facilities, we use our predictive technology to create specific, individualized care plans and patients and their caregivers. Our technology helps us to determine the most appropriate care level, even if that care level is home with care support. Our discharge technology also features components to address social determinants of health, especially for those patients who do not qualify for inpatient rehabilitation or skilled nursing facility services. Valuing relationships ensures we don't operate in a vacuum. We recognize the value providers play in the transitions of care. This is where the talent of our clinicians is engaged to support the providers, ensuring the patient receives the appropriate quality, quantity, and intensity of services. We also help providers close gaps in healthcare by making recommendations to improve healthcare delivery. For example, placing dementia patients closer to the nursing station or taking daily weights of congestive heart failure patients to anticipate potential heart failure exacerbations. My favorite experience is based on one of our care coordinators who worked with the staff of a skilled nursing facility to facilitate a conversation between one of her patients who had recently been diagnosed with cancer and the patient's long-term insurance provider. The patient was so overwhelmed by their new cancer diagnosis, they could not fully comprehend the benefits of their long-term care insurance policy. But the policy would only speak directly to the patient. Our clinician worked in partnership with the skilled nursing facility staff to surround the patient with the support he and his family needed during this very difficult time and successfully help the patient navigate, engage, and understand this new long-term healthcare policy. In summary, naviHealth navigates the alternative payment model world towards value and quality in the post-acute rehabilitation space for all payment models by applying the same patient-centered, evidence-based, clinically guided approach to all of our patients by employing our clinical model, which is based on proprietary technology, clinical talent, and relationships with the patients, healthcare providers, and health plans. Thank you.